Our lecture today is Pyrexia in a pregnancy. Introduction. Pyrexia, which is meaning increased in temperature during a pregnancy, may be due to inflammatory and non-inflammatory conditions. Fever may be due to inflammatory or non-inflammatory conditions. Fever is considered as a symptom, also is considered as a sign when check the vital sign. Pyrexia in pregnancy may be happen during antepartum period or intrapartum period and postpartum periods. What are the risks to the fetus may be related to three different mechanisms. Why we are say the pyrexia during a pregnancy is risky for the fetus. This is due to three different mechanisms. First one, a vertical transmission of infection lead to congenital abnormality, direct effect on developing fetal brain, possibility of preterm labor. Three different mechanisms leading to effect on the fetus during vertical transmission, direct effect on brain, or possibility of preterm labor. The fetus may also be affected due to diagnostic investigation and the treatment of the underlying cause of the pyrexia. Causes. These are antepartum period and intrapartum period and postpartum period. Antepartum period. The main causes are infections. Infections like the following, like urinary tract infection, respiratory tract infection, hepatitis, neurological meningitis or encephalitis, appendicitis, and others. This is mean the cause infection will be cause fever during antepartum period. Systemic like viral, rubella, cytomegalovirus, bacterial, septicemia, protozoal like toxoplasma, malaria, amoebiasis. The third cause is dehydration due to severe hyperemesis gravidarum. Adnexial accident like ovarian cyst, fibroid, torsion, regeneration of fibroids. Endocrine like diabetic ketoacidosis, thrombosis like DVT or preeclampsia, malignancy like leukemia, lymphoma, pyrexia of unknown origin, and sickle cell crisis. These are causes during antepartum period. Infections like any infections, respiratory, urinary tract, GIT, like neurological meningitis, encephalitis, systemic viral, bacterial, protozoal, viral like cytomegalovirus, protozoal toxoplasmosis, bacterial, septicemia, dehydration like diabetic ketoacidosis, adnexial accident like torsion or regeneration of the fibroid and torsion of fibroid or torsion of ovarian cyst, endocrine like diabetic ketoacidosis, thrombosis, DVT or PE, malignancy like leukemia and lymphoma, sickle cell crisis, and pyrexia of unknown origin. Intrapartum period, dehydration or chorioamnionitis at time of labor due to a prolonged rupture of membrane. A prolonged labor will be having chorioamnionitis and dehydration. Postpartum period, puerperal sepsis or puerperal pyrexia may be due to urinary tract infection, endometritis, respiratory tract infection, mastitis, breast engorgement, deep vein thrombosis, wound infection may be normal vaginal delivery and episiotomy, or cervical tear or wound infection of cesarean section. What are the associated clinical features? Associated clinical features with fever. We are say fever or increased temperature is maybe a symptom or sign if there is any clinical feature. when we are say the cause is systemic viral infection like cytomegalovirus virus, like rubella, we like flu, like there is malaise, lethargy, myalgia, arthralgia, rash. Malaria, urinary tract, there is maybe rigor and chills, abdominal pain, nausea, vomiting, alteration in bowel habits. This is acute gastroenteritis, acute appendicitis, jaundice, loss of appetite, anorexia. There is hepatitis, pancreatitis, dysuria, hematuria, pyuria, loin to groin pain, urinary tract infection. الفكرة لما نقول الاسوشيتد كلينيكال فيتشر، يعني لما ناخذ كيس هيستوري ونقول هنا this patient or this female post delivery 7 days post delivery normal vaginal delivery, the main symptom is fever, temperature 39 degree. What are the important point at history to reach to the diagnosis? Must be say about the system, like asking about the myalgia, lethargy, arthralgia, asking about rigors and chills, asking about nausea, vomiting to exclude acute gastroenteritis, acute appendicitis, jaundice, hepatitis, pancreatitis, UTI, dysuria, hematuria. إذا هنا الفكرة من هذه الأسوشيتد clinical feature إحنا خالين بالنا الكوزز. لما نقول what are the causes at postpartum period, patient complain from increased temperature 39 degree 38.5 degree. What are the causes؟ احنا لما خالين بالنا شنو الفيتشرز اللي راح نسألها، اكيد راح نتوصل الى الكوزز. لما نقول هنا يو تي اي انا خالي بالي اسال المريضه عن التشيلز، عن الرايجر، عن الهيماتوريا، ديسيوريا. واحد من الانفستيجيشن اسوي لها المفروض اسوي لها ميد ستريم يورين. لما خالي بالي اني ابندسايتس احتاج الى الترا ساوند. مخليه بالي انه المريضه اكيوت جاسترونترايتس ممكن اسوي لها جنرال ستول اكزامينيشن. مخلين ببالنا انه هذه مريضتنا قد تكون الكوز ماستايتس، المفروض اسوي لها ان اكزامينيشن وجائز احتاج التراساوند تو ذا بريست وهكذا. other associated clinical feature ketone breath, diabetic ketoacidosis, DVT. المريضة لما تكون هنا calf pain, swelling, redness with fever، إذن نتوصل diagnosis DVT. abdominal pain, vaginal discharge، نخلي بالنا chorioamnitis at antepartum period، endometritis postpartum period. مريضتنا سوينا لها cesarean section وكانت هي المريضة أصلا chorioamnitis، سوينا لها سيزيرين سكشن، اتوقع راح يصير اندوميترايتس. فاسكينج لهذه المريضه اللي هي ورا 10 ايام اجتنا فاجينال ديسشارج ابدومينال بين، نخلي بالنا اندوميترايتس. بهذه الحاله راح احتاج الى ابدومينال التراساوند. بين ريدنس اور انجورجمنت اوف بريست نبل ديسشارج، اذا مريضتي اكيوت ماستاتس بريست ابسس. swinging temperature, deterioration of clinical condition, pelvic abscess, septic thrombophlebitis, cough with sputum, hemoptysis, respiratory tract infection, onset of hypothermia, hypotension in a patient who has previously been pyrexial may indicate septicemia. قلنا واحدة من الكوزز bacterial causes septicemia راح يكون، فإذا hypothermia مريضتنا تكون hypotension. What are the important point at examination? What are the important point at examination? Examination نبدي ب in detail. من أول نقطة راح نبدي بها general examination. لما مريضتنا احنا قلنا fever، إذا هي a sign and it is a symptom. المريضة كجنرال examination لازم انتبه إلى level of conscious to exclude meningitis, encephalitis, degree of pyrexia. هل مريضتنا 39 degree, 40 degree، لو 38 38.5 مفروض الديجري. swinging temperature or not. examination for hydration، لأنه واحد من الكوزز قلنا إذا مريضتنا dehydration severe hyperemesis gravidarum راح ممكن نتوقعها تصير عندنا fever at period of the antepartum period. rash or there is jaundice or cyanosis، إذا هذا exclusion هنا مثل respiratory tract infection exclude إلى الهيباتيتس. head and neck مفروض examination للسيرفايكال lymphadenopathy لأن يصير enlargement إذا عندنا infection. neck stiffness to exclude meningitis, encephalitis, thyroid gland, toxic thyroid, nodular goiter. examination of the chest cardiovascular system راح نتأكد من الفيتال ساين clubbing changing مرمر المريضة اللي عندنا respiratory system أيضا مهم إنه نتأكد air entry consolidation breast engorgement nipple discharge redness to exclude mastitis or abscess. abdominal examination. what are the important in abdominal examination? The important point is the following: abdominal wall. If there is any tenderness, rigidity, rebound tenderness, exclude peritonitis or peritoneal irritation. Hepatic epigastric tenderness to exclude pancreatitis. Tenderness over McBurney point is not a reliable sign to diagnose acute appendicitis in pregnancy due to upward displacement of cecum by the gravid uterus. Tenderness may be elicited right up to the right hypochondrium. بالبل liver. إذن هنا راح نشوف هل هو palpation للliver, palpation spleen, iliac fossa if there is any adnexal mass tenderness, palpation to the uterus if there is tenderness, chorioamnionitis or mass red degeneration of the fibros. wound if there is abdominal wound, perineal wound, genital tract for evidence of infection. مثل ما قلنا قد تكون هنا مريضتنا عندها perineal tear, cervical tear أو عندنا episiotomy وصار عندنا infection abdominal إذا مريضتنا كانت هنا cesarean section وصار عندنا infection بها. examination for the calves to exclude swelling, tenderness, red or blue discoloration, Homan sign. spine if there is infection at site of spinal and epidural anesthesia. what are the important investigation؟ احنا عرفنا من الكوزز، دائما نقول من الكوزز احنا نقدر من خليه نباننا الساين and symptom examination، بعدها نوصل للانفستيجيشن نتوصل المن الى diagnosis. فاحنا خالين كوزز البايركسيا during pregnancy. فواحدة من الاتي راح نسوي fasting blood sugar لان قلنا ممكن diabetic ketoacidosis. blood urine and serum creatinine قد تكون هذا مشكلة related to the urinary system. liver function test ممكن مريضتنا hepatitis. midstream urine ممكن urinary tract infection. chest x-ray ممكن مريضتنا تكون هنا respiratory tract problem. لكن إذا كانت pregnant المفروض نخلي لها abdominal shield prior to delivery إذا هي ما كانت pregnant، إذا at time of pregnancy sorry. also microbiology swab, high vaginal swab, endocervical swab, wound, nipple swab, virology swab from throat, blood culture, sputum for culture and urine for ketones. other investigation: blood gases, abdominal ultrasound, Doppler ultrasound scan for the calvane thrombosis. if PE suspected, ventilation perfusion scan should be performed. blood for malaria, parasite, lumbar puncture if meningitis or encephalitis is suspected. management will be depend on the cause. as we say, antepartum period there is causes, intrapartum and postpartum period, and the treatment must be antibiotic, may be indicated to control pyrexia, while a specific treatment is essential to eradicate the underlying cause. إذا antibiotic احنا راح نعطيها، analgesia نعطيها، بعدها treatment المن حسب الكوز اللي موجود عندنا. What is the conclusion for the pyrexia during a pregnancy؟ إذا من البداية عرفنا البايركسيا هي increase in temperature more than 38 excluding the first 20 at postpartum period. The commonest cause of the pyrexia following delivery will be defined as any fever more than 38 degrees on 2 or more occasions. At postpartum period, fever more than 38 degrees on 2 or more occasions, excluding the first 24 hours and up to 14 days after delivery or miscarriage. 90% of causes during postpartum period is due to endometritis, and the other causes cystitis, pyelonephritis يعني urinary tract mastitis, respiratory tract infection like pneumonia, DVT, wound infection, and cesarean or episiotomy or perineal tear. فإذا البايركسيا قد تكون هنا during pregnancy، قد تكون during labor يعني يكون هنا antepartum، intrapartum and postpartum. antepartum لها causes معينة اللي قلنا infection, systemic pyrexia of known etiology, sickle cell anemia, malignancy, dehydration, diabetic ketoacidosis and other. Labor is the most common cause is chorioamnionitis due to a prolonged rupture of membrane, a prolonged labor or dehydration. Postpartum period يعني at puerperium اللي احنا قلنا هنا الكوزز الموست common causes هو endometritis. other causes urinary tract, breast engorgement, respiratory tract, DVT, wound infection like cesarean and episiotomy. This pyrexia during pregnancy, labor and puerperium will be need to investigate and treated appropriately. As we say, the treatment will be depend on the cause. فاحنا اخذنا الكوزز المفروض نسوي investigation مثل ما قلنا fasting blood sugar, midstream urine, التراساوند. هنا المفروض نسوي مريضتنا ايضا نسوي liver function test, blood urea, serum electrolyte and other. Although urinary tract infection are one of the most common causes of pyrexia in pregnancy. إذا فترة الحمل الموست common causes إلى البايركسيا هي راح تكون urinary tract infection. احنا قلنا at puerperium is endometritis. A systemic approach to history taken and examination may help to decide on the most appropriate investigation to help in the diagnosis. The effect of pyrexia as well as its underlying cause on the fetus should be recognized. إذا لازم إحنا المريضة نفهمها وهي برجنت وعندها فيفر، نقول لها ترى هذه الفيفر إلها تأثير على الفيتس. مثل ما قلنا عندنا 3 different mechanism will be effect on the fetus اللي إحنا قلنا ممكن direct effect على البرين، أو إنه راح يصير عندنا preterm labor or vertical transmission and maybe lead to teratogenicity. Thank you very much.